Greetings, everyone. How are you doing? How are you doing with all of the safer at home restrictions and the social distancing? My heart goes out to each and every one of you. I know it's been a long haul when at the time of this recording, a few days before this actually goes live on the podcast channel. And I know that a lot of people out there are kind of getting sick and tired of being stuck at home. And I just ask that you continue the safer at home restrictions, continue the social distancing of at least 6 feet. And today, this podcast is all about the lessons that I've learned through this time. I mean, this coronavirus or this COVID-19 pandemic, it has just rocked our country as well as the world. I have never seen anything like this. It is a once in a lifetime, I hope, disruption to our daily lives. I have intentionally refrained from commenting because I really wanted to see how this was going to play out. And I've recently wrote a blog, and I'm going to share that blog in this podcast a little bit more in depth. But here's a few lessons that I think I've come to appreciate or to learn during this time. I think first and foremost, Providence reigns. And what I mean by that is we are all under the illusion that we are in control of everything that happens. We try and control so much in our world, the time that we wake up with our alarms, the appointments that we set, the getting our kids to school, the train that we might take, the bus schedule. We try and dictate everything in our schedule to make it look like we have complete control over everything. And we aren't in as much control as we think we are. And we've kind of seen that play out. This COVID-19 pandemic, it has affected everyone. It doesn't discriminate either. It doesn't care what socioeconomic class you are in. It doesn't care what education level you have. It doesn't care what neighborhood you live in, what color your skin is, what religious background you may have. It doesn't care if you're royalty or if you're poverty. It does not discriminate, and we cannot control everything. And we cannot control as much as we think we can. So I am guilty of this, and that's why I say this. I try so hard to control every aspect of my life sometimes. I time block my schedule. I'm going to work on this during this time. I'm going to do this at this time. I'm going to do that at that time. This is when I'm going to eat food. This is when I am going to go to bed. This is how many hours I plan to sleep. This is how many minutes or hours I want to work out. This is the time that I am going to play with my kids. This is the time I'm going to work and care for my patients. How many of you are thinking the same thing? You revolve your day around a calendar, and in the whole scheme of things, it falls apart. Nothing is on schedule now. And if you're not used to working at home, I know that your schedule has been derailed, because even if you've worked from home in the past, you've probably never had to work from home with all of your kids doing school from home at the same time for a lengthy period of time. Providence reigns. God is in control of everything. And this isn't me pushing my faith on anyone. For those of you who know me, I am a Christian. I'm a believer in Jesus Christ. I am not here to say that this pandemic is because of God's judgment. I am not here to say that God is the reason for this. And I am not saying that at all. But what I do know is my hope rests in Jesus Christ. And his providence is in control right now. And I find peace in that because I can only control what I can control. I can control what my hands do to help people. I can control what my hands do to hurt people. And when I say that, the simple act of hand washing can hurt or help. If you're not washing your hands, you can hurt people. If you are washing your hands, you are doing a great service to people. Just a simple thing. I can only control what I can control. I can control my mindset, that I can stay positive, that I can stay hopeful. I can control what I'm going to wear for that day and when I do my laundry and when I eat. But I can't control if my patients are going to be afraid to come and see me. I can't control if my schedule is going to be completely changed from what I thought it was at 9 in the morning compared to 3 p.m. in the afternoon. I can only plan and adjust. I will leave the rest to Providence. The second thing that I've come to appreciate is that in a time of crisis, we witness both the best and the worst of humanity. It has been so uplifting to see the numbers of people helping each other, the numbers of people abiding the 6 feet rule of social distancing, the people who are grocery shopping for their elderly and senior community, the people who are wiping down the grocery carts when you come in to get your food. It's also really cool to see the birthday parties that are being celebrated across social media. The parents who are connecting or reconnecting with their kids and helping them with their homework and getting a much due appreciation to the teachers and all the work that they do. I am also saddened by the people hoarding toilet paper, canned soup, and pasta boxes and going through the store. It's mine, that's mine, that's mine. That's a selfish attitude, and it is pathetic to watch. And these may be strong words, and if you're one of those people who hoarded food, hoarded toilet paper, and had a cart full of canned tuna so that no one else could have any, I pray for you. Because an attitude like that is not one of abundance. An attitude like that is limited. And it saddens me. It's disappointing. But in a time of crisis, we witness both the best and the worst of humanity. It's happened in other times, and it's happening now. The third lesson I've learned is our medical professionals and first responders deserve a lot of praise. I am so thankful that they are putting their lives on the front line to help the sick and the illest of people. The emergency rooms, they can't shut down. People still, unfortunately, have heart attacks and strokes or brain injuries and car accidents and fractures and injuries. The emergency rooms and the orthopedic urgent cares that are staying open to take care of these people so that other people can take care of those with the coronavirus. Everybody is putting themselves in harm's way if you are a medical professional. I am fortunate because I have a private practice. I can control what I can control, meaning I can take people's temperature when they arrive. I can screen them. I can send them home. I can limit the number of people in my office at the same time. The emergency room cannot do that. Law enforcement cannot do that. The paramedics cannot do that. The fire department cannot do that. When people are hurting, they go out to help. And I am very happy that they are getting recognized for their bravery and their selflessness. They deal with life and death on a regular or daily basis. They are smart, they are innovative, they are creative, they are resourceful people who want the best for their communities. And I am very happy that they are getting recognized. I am also happy that the scientists behind the pharmaceuticals are getting recognized for their endless and tireless work and trying to find a vaccine or trying to find a medical remedy for people with the COVID-19 virus. This is where scientists shine. And I'm happy that they are getting due respect. Now, they've been kind of beat up because of the opioid epidemic. And as with any drug, there can be side effects. But the technology and the knowledge and the science and the art of putting all the chemicals together to find a cure for something is just flat out fascinating. And nobody, I think, wants to have to take drugs or pharmaceuticals or medications if they don't need them. But they are often needed for a reason. And when I talk about the pain epidemic, pain medications in and of themselves are there for a reason. They can be very, very helpful after surgery to help people get over that initial phase of acute pain so that they can do their physical therapy, their rehabilitation, and get better faster. Pain medications are not meant to be taken for a long time. Antibiotics are not meant to be taken preventatively. They're meant to be taken to kill bacteria. Antiviral medications are meant to help fight off viruses. Vaccinations are meant to do good and help eradicate diseases like polio, measles, mumps. You may have your stance on vaccinations, and I'm not here today to discuss those. I'm just saying that the medical technology available today, whether it's through pharmaceuticals, whether it's through natural remedies like elderberry syrup or essential oils or herbs and spices, all of these things can work together to improve somebody's health. I'm not saying that those are going to cure the coronavirus. I'm just saying they can all work together to enhance somebody's health and improve an immune system. Medications, pharmaceuticals, natural remedies, they all have their place. And those are all being placed in the forefront now. And I am thankful for the medical technology out there. I'm also just thankful for technology in and of itself. And that brings me to my next point. Technology wins and loses. Technology can save people's life. Technology can allow myself and other healthcare providers to treat people through telehealth through their home and the comfort of their home so that they don't have to go out if they're in an immune compromised population, if they actually have the virus, if they're sick with other illnesses. The technology of telehealth is amazing. You can treat somebody through a video chat as if they were right there with you. I've been a big fan of technology in that way. I've been using telehealth for the past couple of years, and now everybody seems to be jumping on the bandwagon. But guess what? It's been there. It's been available to people before, and now it's getting its fair recognition. It is so easy to communicate with people, whether it's a business, whether it's social media or social connections. This is a huge win for technology because 30 years ago, we did not have this type of technology. We would truly be social distancing and social isolation. Technology loses, though, when people are spending so much time on screen time that they forget to have real relationships with the people sitting across the room from them. Screen time can be a great babysitter and a huge excuse for procrastination. That is when technology loses. I also have to say, the rural communities, this is another insight, is that the rural communities have been social distancing for years. Rural communities in the flyover states, these Midwestern states and these small towns, they've been the brunt of so many jokes. But they've been social distancing naturally because they live on acreage, they live on farms, they live in suburbs where the houses are far apart. It's natural social distancing. And I'm not making fun of them either. I'm a suburb type of a girl, and I'd love to live on about 50 acres someday. Probably, I don't know if that'll happen or not, but I think that would be really cool because I'm a little bit of an introvert and I like to social distance on purpose at times. And I think that's good. I think that's healthy to have boundaries like that. But rural communities, they don't just reach out and touch their neighbor. They're too far away geographically. This isn't this is, just an observation that where the COVID-19 pandemic is most affecting is high dense populations like large cities. And I'm not knocking on big cities. I'm not knocking on rural living. I'm just stating a fact that when a major outbreak of a communicable disease like the COVID-19 virus, it's going to affect areas where there are more people. And the people are going to be higher at risk when they're surrounded with high volumes of people. Your big apartment complexes, your business sky rises. When I lived in Philadelphia, I lived in a graduate housing of 16 floors. When someone in my class of 82 got sick, you knew that somebody was going to get sick, and then the next person was going to get sick, and the next person was going to get sick. It was just the common cold or the flu virus back then, or the sinus infection. The COVID-19 virus is all of that combined on steroids. And it's going to affect larger communities and population areas compared to those flyover states or those drive-by areas in the rural community. The next observation or insight that I have is that hand washing will be taken more serious from now on. We in the healthcare community have been saying and preaching for years, you've got to wash your hands. You've got to wash your hands. That's the number one thing. And I would argue that the second next thing is covering your mouth and your elbow when you cough or sneeze. And then the third best thing is drink lots of water. If your body is dehydrated, it is not functioning optimally. Hand washing will never be downplayed again. It is such a serious thing that when I worked in the hospital, you could get penalized for not washing your hands properly. What I mean by that is when the Joint Commission would come in and they would observe and they would walk around the hospital and they would go to the outpatient clinics and make observations, they were watching to see if healthcare workers were washing their hands for at least 20 seconds, if they washed every finger and both thumbs, if they washed the back of their hands all the way up past their wrist. And if they didn't do it for 20 seconds, they wrote it down. That's how serious hand washing is in the hospital system. And that's what I grew up in as a young physical therapist. 1998 through 2012, I worked in a hospital system that was a wonderful hospital system. In fact, I'm going to give them a shout out. TriHealth Inc. Hospital in Cincinnati, Ohio, Good Samaritan Hospital, Bethesda North Hospital, and all of the outpatient clinics there. They did a phenomenal job of making sure that their employees were protected, but their patients were protected. They drilled it into our brains to wash our hands for 20 seconds minimum. Why do you think that surgeons have had to scrub in for years before they do surgery? They scrub in and they scrub out because that is the number one thing that reduces infection. Hand washing will never be thought of as the same. Number 7, if you're counting here, social distancing will be the new normal for a while. Even when we are allowed to go back out and resume other activities, return to work, return to school, I guarantee that if somebody sneezes or coughs into their hand, they are going to get the stink eye. If they blow their nose, sniffle, or touch their face and don't at least use hand sanitizer, they are going to get the look like the mother giving their kid the look of wrath when they misbehave in public. I'm telling you, if anybody does any of those things, cough, sneeze, blows their nose, sniffle, touch their face, and doesn't wash their hands or apply hand sanitizer immediately, they will be scorned. You don't want to become the one who is gross, inconsiderate, and unconcerned about others. Don't be that person. But I can guarantee that even when social distancing is not an order to be executed by the governor, the mayor, the president, people are going to continue that just out of fear in the initial phases as we go back into our lives. My next and final observation is people will go back to their lives. We will return to normal activities. It's going to be like the people of Whoville coming out of their homes on Christmas morning, looking around in disbelief, like, is anything open? Is anybody still closed? We are going to be celebrating. We're going to go back to work. We're going to go back to school. We're going to go back to playgrounds, sporting events, theater, restaurants, and more. And I encourage people to celebrate their community and support their local businesses because the small business is being hurt right now. Support them. We are a resilient people. We are created to be social and connect with people. As the healthcare community finds and creates solutions to solving this pandemic, we will be less fearful and we will leave our homes. I'll go back to the beginning. Number 1 is Providence Reigns. I say that because we aren't in control of the time frame right now when we get to resume our normal activities. But we can control our mindset and how we treat people and how we serve people. How has this moment, this is a defining moment in any person's life. How are you going to move forward from this? Are you going to be inspired? Maybe you're a student listening to this, or you're a parent of a student, and they're thinking they might want to go into the healthcare field. What an inspiring time to see the healthcare professionals saving lives and working to saving lives. If you're in the technology field and you're interested in that, what an amazing time and a gift you've been given to be able to serve people and help people connect so that they can celebrate a birthday with a family member across town or in another state. All you got to do is log on and click on your video chat. It is an amazing time. It's an unprecedented time. And when I say it's an amazing time, because it's a moment that will change people. How will it change you? To all of those who have been affected by COVID-19 and infected with the disease, I pray that you recover well soon. I pray for your families. I pray for all of those you've been in contact with, that they stay healthy and that they get the treatment they need as well if they exhibit symptoms. I wish everyone who has taken the time to listen to this today, I am so grateful to you. I'm so grateful for my health. And I just wish each and every one of you the best health. Do me a favor, if you're a mom, go to be request to be in my Mom Chief of Everything Facebook group. If you're not sure how to find me there, just find me on Facebook at Jeanette Marie. Oops, nope, sorry, scratch that. Jeanette Brant DeWitt, and ask to be my friend. And then when we connect, ask to join the Facebook group, the Mom Chief of Everything group. If you're not a mom, I have another group for you. It's called the DIY Health Habit. And this is all about creating healthy habits, which is a perfect time. It's actually great for moms and everyone else. The mom group is for moms, and that could be a mom who is a biological mom, an adopted mom, a grandmom, a woman who acts as a mom. Doesn't matter. Ask to be in the Mom COE Facebook group, and ask to be in the DIY Health Habit group. Both of these groups are there to serve you. They're free groups. And at a time like this, we need to connect and improve our health. Pray for each and every one of you. I wish you the best health. Thank you.